in my own total abdominal hysterectomy, I had a bikini cut. Just inside, the doctor used dissolvable stitches to stitch the inside. Outside, that's on top of my abdomen, that's the bikini area, pubic area. I have a transverse cut, okay? So the doctor used Dermaband, which is like surgical glue, to hold it together, and Steri-Strip to apply to it. So now there's no wire to lose. I know my mom asked me, when are they going to remove my wire? So I'm like, Mom, there's no wire here. Everything is gonna heal. So she was like, ow, I have to actually show it to her to be able to believe what I was talking about, because she has the mentality of how they do it back home. You know, if you have surgery, there must be wire to be removed, okay? Hello family, welcome to another beautiful edition of Annie Waters vlog. If today's your first day watching me, you are in the right place. If you're a returning friend, well, we shall love our follower, subscriber. Thank you so much for coming back. I really love and appreciate you. Alright guys, in today's edition, I'm going to be zooming into women's health, medical issue, what bothers women the most. Yes, I'm zooming into fibroids, just like prostate issues, enlargement bothers men. Yeah, the same way fibroid bothers women, okay? So I am a patient that is recovering from fibroid surgery. Yeah, it's some of you know I had surgery last week. That's March 9th 2023. Last week Thursday I had hysterectomy done, and in the last 2 years my gynecologist told me that I have fibroid. My menstrual cycle eventually suddenly changed. I was bleeding crazy. I was cramping. I never had menstrual cramp since I started seeing my period. So all of a sudden I started having these cramps, menstrual bleeding, and it was longer than normal. I mean, it was crazy. At some point I was anemic due to this heavy menstrual bleeding. So I was put on medications to control the bleeding. It didn't work. I had implanted IUD, I had Marina. It worked for some time. My gynecologist recommended surgery just to have a hysterectomy. So what is fibroid? So guys, fibroid is characterized by fibrosis, by fibrous tissues. So it is a benign type of tumor that grows in the uterine area of a woman. That means in the womb, in the uterus. That's where fibroid grows. It can also grow outside of the uterus and maybe along the fallopian tube. Non-cancerous is benign, okay? So how does this fibroid develop? It is from the production of the hormones from your ovaries. That's the estrogen and the progesterone that is produced by your ovaries. That's what reacts and reacts and reacts, and they start forming fibroids as age progresses. Some people have fibroid as single girls, and some have it in their 40s or maybe in their 50s. So it depends on the individual. There's no specific time when a woman should have a fibroid. So once you have fibroid and you're having overwhelming heavy menstrual periods, you're having blood clots with it, and you're bleeding so profusely that you have to pad and pad and pad, and you're having these abdominal cramps and you're becoming anemic, hey, it's time to seek another option. So the option of surgery you choose depends on your situation. If you're a single girl that intends to have children in the future, get married and have children, you need to talk to your doctor, okay, so that they will know the specific type of surgery they will do with you. Then if you're done having children like me, yes, we have our own options as well. Then if you're married and you're trying to conceive but you have fibroid, you also have option of the types of surgery you need to have. So please talk with your doctor, your gynecologist very closely. Be honest about your situation so that this will help the gynecologist to make a decision on the type of surgery both of you will discuss and eventually have. What are the treatment options? Well, when you have these fibroid issues that comes with a heavy menstrual period, you can do IUD, you can do oral medications, you can have surgery. When it comes to surgery, we are talking about hysterectomy. Hysterectomy is the removal of the uterus and the cervix, okay? So if you're a young man and you're trying to get married to a girl, please ask her if she have done hysterectomy, okay? If you're planning to have children, so that you don't meet surprises. And young girls, also open up to whoever that wants to marry you that you don't have womb and cervix anymore, okay? It's very tough if you lie about all these things and it comes up at the end of the day that something has been done. Okay, so what are the types of hysterectomy that we should be discussing with our doctor when we have this fibroid issues? It's what we call total hysterectomy. So this total hysterectomy involves the removal of the womb and the cervix, okay? The ovaries are left behind because the ovaries produces estrogen and progesterone. These are the hormones that makes you a woman, that controls the hot flashes and your mood and all those things as a woman, okay? So leaving the ovaries behind helps you to keep on producing the hormones so that you don't go to hormone replacement therapy. Total abdominal hysterectomy with bilateral salpingo or orophorectomy, okay? So this is the removal of the uterus, the cervix, and both of your ovaries. Everything must be gone, including your fallopian tubes. So everything will be gone. Another one is subtotal or partial hysterectomy. That's removal of your womb and the cervix and the ovaries are left behind. Another one is radical hysterectomy. So this one is normally done when somebody has cancer in the cervix, in the uterus. So we have to get everything out, remove everything to make sure there's no trace of cancer left behind. But radical hysterectomy is mainly when somebody has cancer going on. Then another one is laparoscopic hysterectomy. That means the doctor will open some keyholes on your abdomen, okay? So this doctor will pass camera through one of the holes, the bigger holes, while he passes his instrument through the other little holes to the fibroid, and crush it and suction it out. It is the vaginal hysterectomy. So the gynecologist makes incision, vaginal area at the top of it, okay? So they go there and cut all the fibroids out and they remove them through your vagina. So a very thin stitches or glue are put there to hold it together, to hold the incision site together. The uterine fibroid ablation, okay? So this uses a very high radio frequency to do this. So it is a minimal invasive procedure where heat is used to burn all your uterine wall, freeze it, kill it, okay? Your uterine wall will be dead. That means you're not going to be able to get pregnant again, okay? So make sure you're done having babies before you go for this uterine ablation. This can only be done if your fibroids are very little. If you have a huge fibroid, you don't need ablation, okay? Before the surgery, what do? We have all the surgery, the doctor will schedule you for pre-admission. So you go to the hospital where you will have the surgery. They will do labs on you, they will do EKG, and they will check your blood pressure to make sure you're fit, okay? And to also help them prepare of how they will handle you during the surgery, if there is anything they need to look out for. So you go 2 days before the surgery because they don't want you to do a long time, so that in case anything happens in between. Then you follow up with your doctor as well to make sure everything is fine. So once the result is fine, they'll get back with you. They will tell you the surgery is going to go as scheduled. Then they will tell you not to eat or drink anything after midnight. Even during the day, make sure you eat lightly. So it's not like because you're not going to eat after midnight, then you will load yourself up with fufu. Don't do that. So personally, a day before my surgery, I ate very lightly, just fruits and some custard. I drank some juice. I did not even wanna, do anything that will bring any type of complications. So I stayed clear of any heavy food a day before my surgery. Then another thing, make sure you tell the doctor every medication you take at home, so that will also help them to prepare how to take care of you. And again, when you go for pre-op. They will talk to you about the surgery, if you need to sign consent, if you have questions. You know, that's when you discuss all that. By then, they have already taken all your insurance information, your next of kin who is going to be there at the waiting room during the surgery, how they will reach that person. You give them those information. They need it just in case they need to reach out to anybody during or after the surgery. So when you are there at the pre-op, they will show using PCA pump. PCA is more like a machine that when you press it, it will give you to release pain medication through your IV, you know, intravenous line that was put in you. So this will help you to relieve the pain. They will show you how to walk. Then they will talk to you about the SCDs. SCDs are something that pumps on your lower leg. Some of them goes up to higher leg. You know, that helps in blood circulation while you're in bed and also during the surgery. Then there's third hose also that helps in compression and also helps in circulation. Blood circulation is very, very important during this surgery and when you are in bed, okay? So they will talk to you about all these things so that you don't wake up from anesthesia. You are like, oh, what happened to me? What is this? So they tell you all of these things before you go to surgery. So after this surgery, like the hospital I used, they took my husband's phone number and my daughter's phone number because they were there at the waiting room. So they were testing them along the way, updating them about the surgery, telling them where they were, what they were doing, and how I was doing. So there was no doubt about everything. The doctor estimated the surgery to last about 1.5 hours, but the doctor was done within an hour, okay? So it's good to overestimate the time than to underestimate, because that will make the family to be very, very worried. After this surgery, I was wheeled back to the recovery room. I stayed there like hours. And my husband and my daughter, they were able to come visit me. They saw me. And again, I was just woozy. I was not fully awake, but I knew they were there, you know. And I was asking myself if the surgery was done or not done, because I felt like they gave me sedation while I was in that recovery room, and they wheeled me out and they brought me back, and I woke up in the same room. And I was wondering whether I have ever left the room. Until I moved a little bit, I felt the pain and I felt everything hooked up on me. I was like, oh yeah, praise God, because yes, surgery is surgery. This is a major surgery, and they have just total body sleep. So they gave me general anesthesia, you know, to put my entire body into sleep for them to do this surgery. So this is something that is praiseworthy. When this is done, you just have to thank God, you know, that you went that direction and you came back being full human being, you know, and you're able to move and do things. So after the surgery, they will take you back to the room. They will give you a little ice chips to make sure you can swallow. You know, they will intubate you during the surgery anyway, so you are not even the one breathing for yourself. So that's how it is. So I came back, they gave me ice chips to make sure I'm able to swallow, I'm able to, you know who I am, where I am, you know, to make sure I'm mentally intact as well. So after surgery, you can use cold pack on the incision area for 72 hours post-op. After that, you start using warm compression. So the cold compression to the incision site reduces pain, tenderness, reduces swelling and tendency of inflammation, that's infection, okay? So when you interchange with the warm compression after 72 hours post-op, that means this warm compression will increase blood flow to the incision area and also increases the lymphatic flow to the incision site. So it decreases swelling of the soft tissues around the incision site. It facilitates healing and reduces bruising and infection tendencies. When I was in bed, I just had my PCA pump, you know, pushed to have pain relief medication. So if you don't push it, you're not gonna get it. Had Dilaudid, that's hydromorphine. That's what I had in the PCA pump. And I also had hydrocodone. That's a pill, but that was as needed every 4 hours. Then I also had Toldo. It's anti-inflammatory IV medication, so that was also scheduled every 8 hours if I need it. Okay, so for me, I was okay with pain. You have to lay in bed next 24 hours post-op. You don't go nowhere. And before I forget, I also had Foley catheter. Started in your PP area to be collecting urine while you're in bed. You can turn from side to side on your back, yeah, while you're in bed. Then you can raise your head up or down. So within that 24 hours, you can have a little bit of clear liquid. That means some juice, some water, jello, things like that. Then again, you need to pass gas. That's when you know that passing gas or fatting is important. It's an important way of life. So I passed gas. I was up to full liquid diet. Then I proceeded. The next morning I had soft diet because I have passed gas. Then the next other day I had bowel movement. Again, there will be still softener in your diet as well. I had prune juice. So guys, the next morning the Foley was removed, the PTA pump was de-sealed. I was able to get out of bed, sit on the chair. Then after a while, after breakfast, I walk around the unit, so with a nurse aid. Then after that I was able to walk on my own, you know. So again, because I know what is required of me, I was very, very apprehensive of it, and I made sure that everything works normal, that everything I can do within my power, I did. Okay, so guys, before you prepare for any surgery, it is very, very important that you're fit and healthy before your surgery. So this helps to make your surgery a successful one. Eat healthy, that's balanced diet. Exercise, stop smoking, stop drinking alcohol, you know, lose weight if you're overweight. Make sure you're fit before the surgery. Do lab work such as CBC, BMP, your lipid panel 2 days or a few days before your surgery. Okay, they will also do EKG. That's to see how your heart works. If you have any heart problem, they will check your blood pressure. They will ask you questions about medications you take at home. Be honest and tell them all the medications you take at home, both supplements and prescribed medication. And even people who drink all these agbo and all that, please be honest and talk to your doctors about what you take at home. Okay, so post-op exercise, medications, make sure please that all these things you master them. Make sure you do a little at a time. There is no superwoman in this. But again, do not lay in bed all the time. Walk as much as you can. Don't overdo things, okay? For me, I work, you know, on my street like this. I work with my daughters. Luckily, they're on spring break, so that was a good timing. Help yourself heal better. It's very, very important. Then after that, you will go for 2 weeks. 2 weeks follow-up. So my own 2 weeks follow-up was scheduled before the surgery. So during that 2 weeks follow-up, make sure you tell your doctor how you've been feeling, if you have any vaginal discharge, how the wound, the doctor will look at the wound, how the wound is healing. They might do pelvic exam to make sure there's no infection or anything going on. Then the doctor will also discuss biopsy. That means if they collected any specimen from the fibroid or from your uterus and took it to the lab, they will let you know if they found anything that is concerning. Okay, so make sure you discuss any of your concern, your questions with the doctor when you go for 2 weeks. So in other words, you might make a list, put things down, what you need to talk to the doctor about. Is very, very, very important. All right, guys, thank you so much for watching another beautiful edition of Annie Otter's vlog. Please do not forget to like, share, and comment on my videos. I'm your girl, Annie Otter. Thank you so much.